group project, we chose the topic of forced sterilization of Indigenous women. Forced sterilization would be removing someone's ability to conceive a child without the consent from that individual. How has the forced sterilization of Indigenous people in Canada affected Indigenous communities, and what were the long-term impacts of these actions for their survivors and their families? Who was/is affected by coerced and forced sterilization of Indigenous women? In Alberta from 1928 to 1972 and British Columbia from 1933 to 1973, acts that legalized the sterilization of Indigenous people were passed. These acts allowed the Board of Eugenics to sterilize institutionalized patients that, if discharged, would be, without being subjected to operation for sexual sterilization, would likely to beget or bear children who, by reason of inheritance, would have a tendency to serious mental disease or mental deficiency. What were the underlying motivations and justifications used by the Canadian government and medical authorities for the forced sterilization of Indigenous people, and how were these actions rationalized within the context of public health and social policy at the time? Go. What are some experiences of the Indigenous women who were/are forced or coerced into sterilization? Christy Kirkup's article tells the story of Morningstar Mercedes, who describes waking up at 14 years old after surgery and realizing that she was no longer pregnant. Later, Mercedes would come to the understanding that her left ovarian fallopian tube had also been removed during the surgery. Mercedes had been raped and became pregnant after receiving pressure from her community to undergo an abortion. She traveled to Saskatoon for help. One lady got an operation for her bladder, but she had her hysterectomy. Women affected by forced sterilization experience both physical and mental trauma from the procedure and suffer from untreated biological disorders following a hysterectomy. When did forced sterilization occur? As previously stated, from 1928 to 1972 in Alberta and from 1933 to 1973 in British Columbia, acts were passed that allowed for the forced sterilization of Indigenous people. According to the Senate Committee of Human Rights, forced or coerced sterilization has continued to be reported as recently as 2018. Okay. Where did/does this occur in Canada? Forced sterilization of Indigenous women has and does occur all over Canada, with documents showing over 1,000 records documenting the forced sterilization of Indigenous women from North Canada. Women and men who were treated in federally operated Indian hospitals were victim of forced sterilization. In June of 2021, the Standing Senate Committee on Human Rights published a report that describes how forced and coerced sterilization still occurs in Canadian healthcare facilities today.
Go.
Question. What legal and institutional measures have been implemented in Canada to address the historical injustices of forced sterilization among Indigenous populations, and how effective have these measures been in providing restitution and healing for the affected communities? Why our program/field should know about this information. Nurses should be aware of the possibility that Indigenous patients may have trauma related to forced sterilization. It is important for nurses to be aware of the Indigenous cultures and be aware of potential causes of trauma and or intergenerational trauma. This way, they are able to provide better patient-centered care. Women and men face biological medical issues related to forced sterilization. The survivors who testified before the committee described scenarios in which their sterilization lacked free, prior, and informed consent. These include medical staff seeking consent for a procedure at inappropriate times, threatening patients, misinforming patients about the necessity or the effects of sterilization, and in some cases not requesting consent at all. Understanding this information can help us as nurses understand the potential hesitancy Indigenous people may have towards trusting the healthcare system in Canada. This slide we've included some interviews from different Indigenous women who have had experiences with forced sterilization. And this slide describes Brenda Pelleter's experience with forced sterilization, and she describes how she was coerced into getting a tubule ligation after the delivery of her baby. Dominic says, nothing about us without us, so we thought that this was important to include in our presentation. Thank you for watching our video about this very important topic for our field. We hope that you have gain some ideas and keep these stories in your thoughts for your future careers.